Good morning, everyone. Could you please confirm if you can hear us now?
Excellent. Sorry for the technical glitches, and thank you so much, Brittany, for figuring that out. I would have probably done the highest rated webinar you've ever had with me being silent through the whole thing. So sorry about that technical issue. If there are any other problems, please let us know through the question and comment bar for any additional issues that might happen. So. So what we have is we've got a lot of State House news going on. State House right now, it's a lame duck session. Basically, that means that legislators are either have term limited out and will be leaving the legislature, or they've been voted out last election, which didn't happen to too many people. So if there are some folks leaving, it's mostly because of term limits. House Bill 325 is a bill that is leaving. The Senate, the treatment for pregnant women. Basically, what that is pregnant women would be able to there'd be easier ways for pregnant women to receive treatment especially the opiates and those types of things. House Bill 237 was that's actually Senate Bill 237, and because it was Senator Frank LaRosa's bill, that is lowered the amount of fentanyl to possess for criminal prosecution, which is 5 grams. So basically that makes it easier for law enforcement to get a smaller amount of, a person carrying a smaller amount of fentanyl, and they would be subject to arrest and some kind of prosecution. Basically, with all of the deaths surrounding fentanyl, heroin being laced with fentanyl and carfentanil, this is something that the legislature was really strong on. As far as Senate Bill 319, that's the opiate MBR bill that basically it's kind of interesting because it's called the MBR, which means mid-budget, biennium review, which is usually a budget bill, but this is a lot of policy stuff, not a whole lot of money, if any, put into this. Basically what they've added, this is not passed, this is passed the Senate but not the House. It's still stuck in committee there because they're adding a bunch of amendments to this. A lot of the amendments are about the continuum of care. So it basically is including a lot of recovery services in these in this bill. A lot of issues with treatment and all of those types of things. So this is still not out. I'm guessing that there will be some more amendments added. One amendment that did not get added that some folks had been working on was a companion to Senate Bill 248, which is the crush-proof medication bill. That amendment was not added. That has been a big concern with the insurance companies, how they're going to pay for that. So that did not make it into this version of the bill. However, this is not going away for a bit. Well, for a couple of days anyway. I know that they would like this passed out before they leave for winter break, which probably is going to be this week or early next week. So we look for a lot of continued work on Senate Bill 319. So we'll keep you informed of that. The next, so what we also have been doing here at Drug Free Action Alliance, and I introduced this at the last SPCA meeting. If you miss a SPCA meeting, you miss a lot, is we looked at, and I was getting some comments, and I do thank you for those who have submitted comments back, basically a budget document. What we would like to see in the next state budget. We've been asked quite a bit about what kind of prevention services should be added to this bill. Right now, the state does not provide money for drug and alcohol prevention services, so we really thought long and hard about how we do this, talk to some partners that we have, including the County Commissioners Association and the Board Association and NAMI and many other folks that we deal regularly with, and some we don't deal normally, regularly with, to try to get more of a consensus about this would be the best way to basically have prevention in Ohio. So those are kind of the 4 prongs of this draft document. This will have to be submitted. We're teaming together with NAMI and with the Ohio Council of Behavioral Health Care Providers, which is Lori Chris's group, if you know her, the Board Association, Mental Health America, SBIRT, and a lot of other folks, on a kind of comprehensive document. And these are kind of our 4 prongs as far as prevention goes. If we want to go to the first slide here, basically it is investing in community-based prevention services. We feel that a unified strategy around the strategic prevention framework is going to work best for communities. The SPIF process is something that the state has been very diligent in providing training for. I know that Prevention First is doing a lot of work around the SPIF with the PFS grants that they have, and we absolutely believe in that process and think that's the best way that that communities can maximize their efforts and also maximize the money that they're getting. So we would like the SPIF to determine a unified strategy to maximize funding and impact, and also have a community coordinator, whether that be an existing prevention coalition person or someone within the board system, or someone who is newly hired, who has prevention credentials. It's something that we would like to leave up to each community, but someone who actually has prevention experience driving that conversation. We're asking for a total investment. We're starting off small. This is going to be the first step in hopefully a more robust plan as we go forward. So we're kind of taking baby steps. No money to basically community-based services, $6 million, which is on average $68,000 per county. The legislature, if this were passed, I'm sure would somehow have some kind of regulations around how bad the opiate issue is, or another drug problem, and maybe even some population-based type of stuff. So this is something that we really want to make sure that our communities are being fed, that they're working, frankly, with Brittany at the coalition level for best practices and all the valuable work that she's doing and the knowledge she has. I mean, we've got one of the best resources in the entire country, and in Miss Sandage, and we really want to make sure that she is that the work that she is here for is actually going to be something that can be in every community around the state. And this is also other efforts. What Prevention First is doing. I mean, the number of coalitions that they have in the tri-state area is phenomenal. I mean, the work that coalitions are doing are really, really powerful, and that is what's really going to, it isn't really a program, we don't believe, or anything like that. It's going to be community-based processes that's going to turn the tide on this issue. So we really, really believe in that, and would like $6 million for that. The second prong is that we're going to invest in, actually that should say school-based prevention services and not community-based prevention services. Ohio has nearly 3,600 public schools. This is going to be in something that the governor has looked at, that the Attorney General has been looking at. Molly Stone and Marcy Seidel are both on a committee where they're looking at school-based prevention services and what needs to be part of that curriculum, if there is one. Ohio has nearly 3,600 schools, and certified providers, and I'm talking about the Ohio Council of Behavioral Health Providers, estimate that it costs somewhere around $10,000 a year to have a certified prevention provider in a school building 1 day a week. So as we did a little bit of math, this would require an investment of about $11 million from the state, $36 million across the board. We're talking about federal grants and DFCs and all of those types of things. But we really need that that extra investment from the state. Again, the state hasn't invested in prevention to any level. A couple of years ago with the MBR, they invested $6.5 million. But this would be an $11 million investment, which basically equates to about $6.36 per student in public schools in the state of Ohio. So how this is again something that we believe that communities should figure itself out. They know what works best in their own community. Is it someone that's actually placed in the schools, or is it someone that is is a coalition coordinator or another prevention person who actually goes into the schools? That is something that we believe that communities can make that decision. The next prong is require the use of trained and certified personnel. There is a need for certified prevention specialists across the state. I know that we here at DFAA, Prevention First, ADAPO, are all providing trainings to try to get our workforce built up. And we want to make sure that that workforce is strong, because I think we're quite underrepresented. I don't know if there's a prevention specialist in each county as far as the state of Ohio go. So some of the questions that we have, with the workforce being underrepresented and this being something that we would like, would we want to include prevention specialist applicants as well? If they're going through the trainings and those types of things through SPCA, PFS, or ADAPO. The next piece, the final prong, is that we need to rely on research to inform our prevention services delivery. We need data to inform our decisions. We have the OES survey from the state. We have the YRBS survey that some communities use. And we need to let the data kind of drive where our priorities are, but we also need the data to basically evaluate what we're doing to make sure that what we're doing is correct and is actually making a difference. So we really want to push the reliance upon data, that scare tactics don't really work. We know that, and that instead community-based processes and working together really are wise investments for the state of Ohio. So with that, we're going to be pushing that. And again, if you have comments before Friday, that would be fantastic. I've heard from some of you already, but if you have comments on any of those types of things, we would love to have those comments so that we can get that input into the final document. Listen to a very interesting webinar. So this is not my information. This is from a guy named Andrew Kessler, who is he's the CEO of a group called Principal Slingshot Solutions, which he is a DC lobbyist for behavioral health. He his entire business is based on lobbying for behavioral health issues at the federal level, working with congresspersons and senators on that. So I'm taking this basically from him. This is not my work, this is his, and I want to make sure everybody knows that so that nobody's accusing me of stealing stuff. And also, if this is all wrong, it's not my fault. But he does say that he is not a soothsayer or a fortune teller. However, the information that he uses is based on past experience of the cabinet. So with a new president coming in, and it being this president being somewhat unconventional in not having policy experience and those types of things, never have worked in an elected official's office before, what we really don't know what to expect. So he had this webinar and included some of the things that we might need to watch out for and pay attention to as DC rolls along. He first brought up the platform of the Republican Party. At the Republican National Convention, I had prevention on my mind, so instead of prevention, I should say convention. Am I on cold medicine or what? I've misspelled a lot of things today. Republican National Convention, they issued a statement for the first time on the heroin issue. Basically their statement was the misuse of prescription painkillers and opiates is a problem. Heroin and opioid abuse touches our communities, our homes, our families, and in ways that have grave effects on Americans in every community. With a quadrupling of both their sales and their overdose deaths, the opioid crisis is ravaging communities across the country, often hitting rural areas harder than urban. They even go on to say in their statement that because overprescription of drugs is such a large part of the problem, Republican legislation now allows Medicare Part D and Medicare Advantage plans to limit patients to a single pharmacy. Congressional Republicans also called upon CMS, which is Centers for Medicare and Medicaid Services, to ensure that no physician will be penalized for limiting opioid prescriptions. So basically what their thoughts are, and this is, again, not only do we have a Republican president, but we also have a Republican-controlled House and a Republican-controlled Senate. So this kind of can give us a little bit of an insight into what the federal government, Congress, is going to do. These statements in themselves are that they are basically going to limit patients to a single pharmacy. If they're Medicare, if they use any of these Medicare plans, and then also that if you are a Medicare patient, then if your doc says, you know what, I'm limiting your opioids, that physician will not be penalized in any such way. So this kind of gives us an insight into what they're thinking and their strategy and kind of combating the prescription drug problem in this country. So what has Mr. Trump said? So President-elect Trump, and I am not, first off, I work for a Republican and a Democrat. I'm not saying anything against anybody, whether, or for anybody. This is just what we have. This is the information we have. So please don't take this as anything except guesswork at this point. And if you're really mad at somebody, get mad at Mr. Kessler. But at first, on the campaign trail, Mr. Trump addressed the opioid issue. He would only talk about trafficking. And basically, it was about the wall. If you remember the big wall that President-elect Trump was going to build, he was going to deal with the drug problem by building this big wall and stopping people at the border, and taking care of heroin trafficking and everything like that. Well, even in the best-case scenario, the DEA says that they only estimate that they stop between 10 and 20%, 20% max. And what's interesting about some of the DEA comments is that, when talking to the Pablo Escobars and some of those folks who are the big kingpins, is the drug traffickers actually insert a 20% loss into their business plan. So they expect to lose 20% of their product through DEA efforts. This is not going to stop. This is not going to stop the heroin epidemic. He did go on to say, President-elect Trump, as far as treatment is concerned, it's very hard to get out of that addiction, out of heroin. This is his quote. We're going to work with them. We're going to spend the money, and we're going to get that habit broken. The problem is, if it was a habit like chewing, biting your fingernails or something like that, I think it'd be a lot easier to fix. We've got to convince the president-elect and some of the folks that he is appointing that this is a behavioral health disease that has a continuum of care, including prevention, treatment, and recovery, that needs to be addressed at the federal level to actually make any kind of inroads or a dent in the problem we have. Towards the end of the campaign, he started to soften a little bit. He did reiterate his commitment to trafficking and enforcement, but at a addiction policy forum in New Hampshire, he also addressed a more comprehensive approach. And he specifically pointed out the CARA bill that was recently passed in in Congress. And he said this legislation is an important step in the right direction. He also said he wants to expand drug courts and mandated treatment for those with substance abuse disorders. He says that they can be cost-effective, appropriate, and humane, and the response to addiction can be incredible. So there was softening. Somebody got to him, and I don't know whether it was his advisors or some other person or some other group of people, but he tended to soften that this is not just a trafficking problem. This is a problem that extends far beyond whether we have a border wall or border patrol or anything like that. I think even going on, so what he said is he would like to dramatically expand access to drug treatment. He would like to alter Medicaid policies that obstruct inpatient treatment, including that IMD exclusion. He also wants to improve the availability of Narcan and restore the accountability of the veterans, the VA, by granting accessible support and resources to U.S. veterans with substance use disorders. So he really did soften a lot, which is, I mean, it's almost two different people talking on the same issue, which is interesting. Some of his appointments, Senator Jeff Sessions, he was appointed to be the Attorney General nominee. He's very, very strong on marijuana. So we don't know what that might mean for legalization. I know some of the pro-marijuana folks that I've spoken to are quite frightened about what this is going to do. Is he going to go shut down businesses? Is the Department of Justice going to go into these states and shut things down and say, no, you're going to be following federal law instead of state law? We just don't know at this point. And one of his comments that he used, that Jeff Sessions used, was knowledge that marijuana is dangerous. You can't play with it. It's not funny. It's not something to laugh about. And to send that message with clarity that good people don't smoke marijuana. Now, in the beginning, I think the message is very apropos. That it's not something you play with. I think it's a good message for kids. It's not funny. It's not something to laugh about. He should have stopped there, because the whole issue about good people don't smoke marijuana kind of flies in the face of the addiction disease. That does this imply that bad people only use drugs or things like that? So this is something that is concerning. Also, he's a big supporter of mandatory minimum sentences for drug possession, which is something that this Congress has tried to, actually this president has tried to turn around. This is, we don't know what we're going to get from this. One of the last issues is actually federal budget spending. This is something that is quite concerning. Why is this concerning? Because of in 2011, if you remember back then when the government shut down, there was a sequester. Basically, one of the agreements was that there would be spending caps in fiscal year 2018. Those are going to be harsh. These are non-defense spending, so all domestic programs are going to somehow have these caps put on them. Any kind of discretionary spending will be through the Budget Control Act of 2011 is also they're going to be taken into under this plan as well. And basically, according to David Reich, the budget would cut these programs, these discretionary spending programs, by $47 billion for 2018. And then, if that isn't bad enough, we have about 3 to 4% inflation rate for healthcare spending, which includes substance use disorders. It's going to freeze funding at that level for the next 8 years. So not only you're going to get cut, then it's going to freeze it until 2026. With 70 to 80% of substance use disorder services being accounted for through federal federal programs and those types of things, we're afraid that treatment and prevention are going to suffer. That does include the SAP grant. We got $1 million extra in SAP grant in the last budget cycle. But that's 0.4% of an increase, 0.4%, whereas healthcare costs and other inflation increased at 3%. So it really isn't even keeping up with the rate of inflation. So we're incredibly worried. And when we go to CATCA, if you go to CATCA this year, this is going to be something that we need to have a really good ground game on. That this is not something that can be fixed because by making them good people or stop your habit or anything like that. This is going to need money for treatment. It's going to need money for prevention services. Again, those community-based prevention services, and law enforcement does play a part in this, but we can't just rely on law enforcement to stop. To stop 20% of the drugs coming across the borders. So we're quite concerned about everything that is going on, and we really want to make sure that our congresspersons know that we are, this is quite unacceptable. That 10 years, we're going to have basically a system that doesn't move on any spending whatsoever because of something that happened in 2011. So I understand we do have a question. So will the request for $6 million for community-based prevention flow directly to communities, or will it flow through a grant process with DFAA and Ohio MOS? Actually, we would like it to flow more directly to communities, so that folks, this is actually something that could go through either the boards or even the county commissioners to basically delve out that money. Too many middlemen might decrease that funding, and the request for funding, we want to actually get to communities and not to state level folks, and I include ourselves in this. We know that communities need more money, so the reason we wrote it the way we did was to make sure that communities got it and it wasn't stuck in some bureaucratic system at the state level. So I hope that answered the question. And so if you've enjoyed this, boy, we've got more fun coming. Actually, one of the best conversations I think that we have is at the SPCA meetings. It's the ability for SPCA members to voice their concerns, ask any questions. Webinars are somewhat limited in the way that free-flowing conversation can happen. So at SPCA meetings, we always have an advocacy time that we can ask about these things, what's going on, what's our strategy, those types of things. I know that the SPCA advisory group also has some strategy points that they're working on. But the next SPCA meeting is January 17th, and Brittany will be sending out locations and times and all of that kind of stuff. But put it on your calendar for January 17th to be part of that discussion. With the budget coming up, it has to be signed by June 30th. We all need to be on board to make sure that prevention is actually heard and represented within the state of Ohio budget. And frankly, this is honestly one of the more robust times for prevention because of the opiate issue. Sadly, that's what had to get legislators' attention, but at this point it is a time that we need to really prove our worth and get out there and advocate for prevention in our communities. So January 17th, put it on your calendars, and I will see you there. So if you have any questions or anything, please feel free to email myself or Brittany, and we will certainly work with you on things. And I thank you so much. Have a wonderful, wonderful holiday.